Good day, sir. I am Wendy Jessica Wayara, Section Service, and in this video, we'll be talking about the concept of safe drug or medication administration. So the importance of the medication administration is to ensure the medications are given safely and accurately. So it is a cornerstone of medical care. So there is a 10 rights of medication administration, but I will be discussing only 5 basic rights. So the first is right patient. As a nurse, you are responsible and you want to make sure that the right patient for this medication, because sometimes in a unit or in a room there are patients that have the same first name, the same last name, and even the first name and last name. So you have to make sure that the medication that you will be giving is for the right person. So in doing that, we have to do some safety checks. So we need to use at least 2 identifiers. So you should ask the patient's full name, like the first name, and the last name, and even the middle name. And then look at the patient's arm identificator. So identify and check if it is matches. Next is right medication. So when you are looking at your safety medication for this right, you have to be careful and analyze the name of the medications, because there is some medicines that has a similar names. So you have to read from the beginning up to the end, and make sure that it is matches. Like example, these 2 drug names, the acetazolamide and acetohexamide. So acetazolamide is diuretic and the acetohexamide is for diabetes and lower the blood glucose. And make sure also the expiration of the drug, if there is a damage, and ask the patient if they has any allergy. And just to confirm, ask the patient, I am giving you this, so have you ever have this medication in the past, or home medications? Next is the right dose. So just like the right medication, you're gonna look at that order. So compare it if it is the right dose. Like if the doctor order give the patient a half of this medication, so you have to follow what the doctor said, because if you did not follow, maybe you can overdose the patient or underdose. So in this part, you have also to verify or check your math in medication. Next is the right route. In this part, just close attention to the way of medication need to be administered. So there is many different routes, so we can give them medication a various ways. So the common is giving them through their mouth, but you can also give them IV, the intravenous, and you can give them also sub-Q, the subcutaneous, on the muscle typically, and etc. And then you have to make sure also you have a supplies for the way you give medication. So in this part, you have to make sure or confirm that the patient can swallow the medicine properly. So if you do IV, which is the intravenous, you have to make sure that it is working, and make sure the right size of needles. So you have to make sure also you are prepared in different routes of giving medication. So the last basic right is the right time and right frequency. So before you even get in that medication, look in that more medication administrations record and see when this was last given especially, and watch if it matches up in an original medication. And make sure that the medication you do, it is not too late or not too soon. And pay closer also attention to those time critical medications like antibiotics, insulin, or etc. Because it is very important at the time you give those medications. And then review the policy of the hospital you are working, because they're gonna outline those time frame when you can give medication, when they are not too late or too soon. So that's all the 5 basics rights of medication administration. Thank you.